Men are not just breadwinners. These are husbands. These are the fathers. These are the sons. And their role is very important. It's critical. We wanted to encourage men to take responsibility in terms of HIV and other chronic illnesses, and not to react, to be proactive. So my name is Mandla Kayel Majola. I was born and bred, battered in Gugulethu. I'm the son of the soil. I was very fortunate to be part of people who started movement for change and social justice.
MCSJ got its start kind of out of a research project that I was helping to run in 2017. We were doing research in the Gugulethu community and working with people like Manla and others. And they were really appreciating the research, but also frustrated that nothing was happening with the research we were kind of doing. And we weren't in a position to do something, in Gugulethu to kind of translate research into action.
We noted that majority of times when the researchers are coming to poor marginalized communities, they do research, conduct their research projects, and then they vanish without allowing the same community where they conducted the research an opportunity to meaningfully engage with their findings.
They, I think, recognize the kind of need for a group to work more closely with researchers and with community and kind of bridge that gap.
The research Indaba that we have jointly put together with the University of Cape Town and University of Virginia, it's an event that is aiming at bringing the research institutions, poor marginalized communities, and movement for change and social justice together in the same space, and to ensure that the relationship is constructive and meaningful for both parties.
Amanda! Viva MCSJ, viva! Viva UCT, viva! Viva UVA, viva! Viva fa, viva!
Molweni. Inkosi kakhulu ngokubalapha namhlanje kuseni kwaye namkelekile kule indaba yophando. Ndiyavuya kakhulu ukuba lapha nani nonke. Igama lam ngu-Chris Coven. Igama lam lesiXhosa ngu-Mcebisi.
If research is not useful for the people, it is meant to empower, the research may be seen as wasteful or even harmful.
So the program in some ways was decided quite early on because we wanted to have a one-day event. We wanted to make sure that we had sufficient time for small group research, feedback and engagement. We wanted to make sure we had enough time in the plenary session at the end so that people could feel they could start to think about next steps and resolutions and how do we build on this work and this energy.
How can we use the findings in policy or practice? The first thing I think is to just highlight this risk. People do not know about it. Did you know about this? And so the first thing is to say, look, this is how it is, because then you can start to do something about it.
And it took us more than a year to get the data because many of them we had to build the confidence.
They want to love, they're not always controlling. They are scared in this relationship.
What was also interesting is if you are a father or mother, that was a very strong motivator to stay on treatment.
We can't say, okay, when this cup of isiXhosa must be summarized.
Ithi ke ngoku phayana utata angazabikho phambi komama abe enenkxaso.
I'm happy with what I'm seeing so far, even though But I'm happy also, even though the numbers have gone beyond what we actually expected. Because we were expecting around about 500, 550, but I think we've gone more than that. If we are not approaching 700 now.
The event looks very good, and I see people that are participating, especially men.
As I was going around, I saw men engaging in these topics, and they were the ones who are coming with answers, with some solutions, with everything that now. So it's what we wanted to see.
I found that the community was just extremely well engaged in the research, and often that's a dance that you sort of have to engage in, is ensuring that the findings from research is presented in a way that community can engage with. And so it was good to see that there was lots of engagement and lots of questions from the community.
We underestimate the interest that people have. And I've been very surprised when we've done research presentations at the real interest people have in the research. And maybe it's undirected and maybe it goes in a different, but there's a real interest in it and a real feeling of being respected because it's been given to them. Because people have actually respected them enough to invite them here, to make a nice space, to have it organized, to feed them and to listen to them. And I think there's a lot more space in that, for that than we think.
What we want to do today is really two things. The Indaba was a big event and a successful event, but we really need to talk about what happens next. And the second thing is that part of this Indaba has been bringing together members of MCSJ with members of the Charlottesville community and the University of Virginia, and this was a chance for both groups with a little more space to be able to talk with each other.
The level of men's engagement in each of those groups was really impressive.
People wanted to get the information for tomorrow. They also wanted to learn the information and pass it on.
The community realized that there were certain things that they took for granted in terms of hierarchy, and they realized that individual community members could be more involved in learning, in pushing research in certain directions, but also in taking control of the community aspects of their health.
I think the goal is to go for the bottoms-up approach, but I think it's work in progress in any case.
I do not want a situation where when we want to protect our community and then it turns out to be us sort of ring fencing and gatekeeping the community, and that relationship is not transformational, it's transactional at the end of the day. How much am I going to get if I approve this? It has to be genuine. It has to be credible.
So thankful that you guys came and shared this. I think it's very hard to understand this over Zoom. And I love the examples. I think this really concretizes it for us.
We've been trying to think about the Indaba going forward is that it's really one event in what ideally is a series of ongoing meetings. They don't all have to be 500-600 people, but we need to support an engagement between all these different groups over the longer term.
The foundation has been laid by this research in Indaba to talk about a more structured way that communities can engage with researchers. Potentially a research board which could consist of various representatives from various community organizations could be a valuable vessel to engage and enhance research from the pre-inception phase almost throughout the continuum to knowledge use, dissemination, and using knowledge for action, as it were.